G'day everyone, Dr. Amelia Fraser here. I've been working as a urologist here in New Zealand for over 15 years now, and today I want to talk about something that affects heaps of blokes, but nobody really wants to discuss at the pub, right? Incontinence. Yeah, I know, not exactly a cheerful topic over your morning flat white, but stick with me because what I'm about to share could genuinely change your life. Here's the thing that really gets me fired up. Why do so many doctors tell you that incontinence after 50 is just something you've got to live with? Like it's as inevitable as the All Blacks winning the Bladder Slow Cup. Yeah? Well, I'm here to tell you, that's a load of rubbish.
What if age-related incontinence isn't actually real? What if these are just excuses from doctors who haven't kept up with the latest research? Look, I've seen hundreds of patients over the years, and I can tell you straight up that many of you have been misdiagnosed, or you're dealing with underlying conditions that nobody's properly investigated. So today, I'm going to reveal some secrets from traditional medicine combined with modern urology that have helped loads of my patients ditch those expensive pads and medications. We're talking about real solutions here, not just managing symptoms. Now, before we dive in, I want you to understand something important. You're not alone in this. If you think you're the only bloke dealing with this, you're dead wrong. The stats show that 1 in every 2 men over 60 experiences some form of incontinence, even if they're too embarrassed to mention it to their GP.
But here's the good news. There are quick and effective ways to restore normal function to your urogenital system, and I'm going to show you exactly how. Right, let's get stuck in. First up, we need to understand what's actually going on in your body, because once you understand the mechanisms, you can tackle this problem head on. Think of incontinence like a dam that's sprung a leak. Despite all your efforts to stop it, the mechanisms that control urine flow just aren't working properly anymore. This can happen for heaps of different reasons. Weakened pelvic floor muscles, chronic prostate issues in men, hormonal changes, even being overweight can contribute to the problem. Now, I've got to be honest with you. Incontinence is a problem that tends to get worse as we age. Our bodies become more vulnerable, and that's just a fact of life. But here's where most doctors get it wrong. They assume it's irreversible. I've been working with older adults for years now, and I can tell you that's simply not true. Let me break down the main types you need to know about. Stress incontinence is when you leak a bit, when you cough, laugh, or lift something heavy. This happens because the pressure in your abdomen increases, and if your pelvic floor muscles are weak, well, Bob is your uncle, you've got a problem. This type can happen at any age, but it's particularly common in blokes who've had prostate surgery or who've done heaps of heavy lifting throughout their lives. The other main type is what we call an overactive bladder. This is when you get these sudden, urgent needs to go to the toilet, even when your bladder isn't actually full. It's like your bladder's sending false alarms to your brain, and it can be absolutely maddening. Here's what's happening mechanically. Your bladder muscle needs to contract to push urine into the urethra, right? Then the urethral muscle needs to relax to allow the flow. But as we age, these muscles lose strength and elasticity, and the pressure in the urethra decreases. This means even a slight increase in abdominal pressure can cause involuntary leakage. Other things can mess with your bladder control too. Constipation is a big one that people don't realise. Head or spinal injuries, Parkinson's disease, stroke, diabetes, infections of the genital tract. All of these can make the problem worse. Now, some people reckon there's a genetic component to incontinence, that it runs in families. Danish scientists did actually identify 6 genetic mutations that can cause incontinence. But here's the catch. That study only applied to young people. For age-related incontinence in older adults, genetics isn't the culprit. So don't go blaming your old man for this one. Let's talk about overactive bladder for a minute, because this affects heaps of older Kiwi blokes, and it's more common than you'd think. Even a small amount of urine can trigger the urge to go, making you feel like your bladder's absolutely bursting when it's barely got anything in it. This condition isn't dangerous, but crikey, it can seriously impact your quality of life. You're constantly looking for the nearest dunny. You can't enjoy a game of golf without interruptions, and forget about long road trips down to Queenstown. So, what can you do about it? Let me give you some practical tips that actually work. First tip, don't wait until you're absolutely busting to go to the toilet. When you need to go, just go. Don't try to be a hero and hold it for ages. A healthy adult can hold urine for up to 5 hours depending on fluid intake, but that doesn't mean you should push it to the limit every time. Now, you might have heard that you should train your bladder by holding on as long as possible. That's partially true, but there's a right way and a wrong way to do it. Bladder training is actually a legitimate technique for treating overactive bladder. But you don't just suddenly start holding it for hours, you do it gradually. Here's how it works. Start by delaying your toilet trip by just 5 minutes each day. During that time, distract yourself. Think about your grandkids' birthdays, recite the names of the All Blacks starting 15, do a crossword, scroll through the news on your phone, whatever works for you. Then gradually increase the time by 10 or 15 minutes each day until you can comfortably hold it for about an hour and 15 minutes. That's the sweet spot. But here's what you shouldn't do. Don't go to the toilet just in case, before you actually need to. This is a really common mistake. When you do this, you're training your bladder to expect emptying even when there's barely anything in it. Over time, you'll start getting the urge to go even with tiny amounts of urine, and that's exactly what we're trying to avoid. On the flip side, don't hold it too long either. Being too patient can actually lead to urinary tract infections. When your urinary system is full and you keep holding on, the urine can stagnate and cause inflammation. It's like stagnant water in a puddle, yeah? Stagnant water has more bacteria than flowing water. Same principle applies here. Second tip, create a toilet schedule and stick to it. Go at least every 3 hours, like clockwork. Set an alarm on your phone if you need to. This helps train your bladder to work in a predictable rhythm. Third tip, control your weight. This is a big one, especially for stress incontinence. Extra kilos put extra pressure on your bladder, particularly if you're carrying weight around your middle. I know it's easier said than done, especially when you're getting on a bit, but even losing a few kilos can make a real difference. Now here's where we get to the really important stuff. These tips are all well and good, but if you want to properly tackle incontinence, you need to strengthen those pelvic floor muscles. This is absolutely crucial, and it's where most blokes go wrong, because they either don't do the exercises at all, or they do them incorrectly. Let me teach you some exercises that actually work. You don't need any special equipment, just a bit of time and regular practice. You can start right now if you want. First exercise. Imagine your pelvic floor muscles are like a lift. Contract them from your perineum all the way up to your belly button. Then slowly lower them back down. Do this 10 to 15 times. It might feel a bit weird at first, but you'll get the hang of it. Second exercise. Imagine you're trying to stop the flow of urine midstream. Contract those pelvic floor muscles and hold for 5 seconds, then release. Repeat this 10 to 15 times. This one's really effective for gaining control. Third exercise. Lie on your back with your knees bent. Lift your pelvis off the floor while contracting your pelvic floor muscles. Hold for 5 seconds, then relax. Do this 10 to 15 times. This one works brilliantly because it combines pelvic floor strengthening with core stability. The beauty of these exercises is that they only take about 5 minutes a day. You can do them while watching the rugby, waiting for the bus, or even sitting at your desk. Nobody will have a clue what you're doing. Now let me talk about Kegel exercises specifically, because these are absolutely proven to work. Kegels can help with all sorts of issues down there, not just incontinence. The best part? You can do them anywhere, anytime. Just contract and relax those muscles as if you're trying to stop urinating mid-flow. Do these exercises 10 to 15 times a day. You can do them lying down, sitting, or even standing. You can vary the intensity too. Try both strong, quick squeezes and longer sustained contractions of about 2 seconds each. But here's the thing. I've had heaps of patients tell me they tried Kegels and they didn't work. When I dig deeper, I usually find out they weren't doing them correctly. So let me tell you exactly how to do them properly. When you're doing Kegels while sitting in a chair, your body shouldn't lift off the seat. If you feel yourself lifting up, you're using your glute muscles instead of your pelvic floor muscles. That's not going to help at all. Focus on the internal muscles, not your bum. Here's another crucial point about breathing. Relax everything when you breathe in, then contract when you breathe out. Never hold your breath while doing Kegels. Proper breathing is absolutely essential for these exercises to work. Consistency is key, mate. You need to do these exercises 10 times per session, every single day. No skipping. I know it can be easy to forget, so maybe tie it to something you already do daily, like your morning coffee or the evening news. Right, now let's talk about some natural remedies that can complement your exercise routine. I'm a big believer in combining modern medicine with traditional approaches when it makes sense. Herbal teas can actually help strengthen your pelvic muscles and reduce the frequency of urination. Here's a ripper recipe. Pour boiling water over 1 tablespoon of dried sage. Let it steep for 15 minutes. Then drink half a cup 3 times a week. Sage has been used for centuries to help with bladder control. Nettle tea is another good one. Steep nettle in boiling water for 15 minutes, then drink it twice daily, morning and evening. This can help improve bladder tone. St. John's wort has anti-inflammatory properties that can support bladder health. Brew it the same way as the sage and drink it twice daily. Now, a word of caution. While these herbal remedies don't have obvious contraindications, they might not be suitable for everyone.
Listen to your body, and if something doesn't feel right, stop using it. And obviously, check with your GP if you're on other medications, because some herbs can interact with prescription drugs. Here's the honest truth though. Natural remedies can be helpful, but they're not always the complete solution. Sometimes they work brilliantly, sometimes not so much. It really depends on what's causing your incontinence in the first place. For stress incontinence, the type that happens when you cough, laugh, or lift heavy things, There are legitimate treatment options available. Lifestyle changes like losing weight and quitting smoking can make a huge difference. I've seen blokes who drop 10 kilos and their incontinence improved dramatically. And if you're still smoking, well, every time you cough, you're putting pressure on that bladder. Just saying. In some cases, surgery might be the only real solution, but that's usually a last resort after you've tried everything else. Look, I want to be straight with you. I've been doing this for over 15 years now, and I've seen what works and what doesn't. The exercises I've shown you today, if you do them properly and consistently, can make an absolutely massive difference. I'm talking about being able to go on a tramping trip without worrying about finding a loo every 20 minutes. I'm talking about being able to laugh at your mate's terrible jokes without any embarrassing moments. I'm talking about getting your confidence back. The key things to remember are these. 1. Don't believe anyone who tells you incontinence is just something you have to live with because you're getting older. That's rubbish. 2. Do your pelvic floor exercises every single day. Mark it in your diary, set a phone reminder, whatever it takes. 3. Give those natural remedies a go if you're keen, but don't rely on them alone. 4. Manage your weight and stay active. And 5. Don't be embarrassed to talk to your doctor about this.
Trust me, we've heard it all before. I really hope this helps you out. Incontinence doesn't have to control your life. With the right approach, the right exercises, and a bit of patience, you can get back to living life on your terms. You deserve to enjoy your retirement years without constantly worrying about where the nearest toilet is. Yeah. If you found this helpful, I'd love to hear about it. Drop a comment below and let me know how you're getting on with these exercises. And if you've got mates who might benefit from this information, share it with them. Sometimes the best medicine is just knowing you're not alone and that there are real solutions out there. Take care of yourselves and remember, you've got this. Kia kaha, everyone.